Ryan, what's on your radar?
So unless you were wandering aimlessly around Capitol Hill and accidentally stumbled into a committee room, you probably didn't know that Congress held a hearing on Medicare for All this week. That's not an accident. The media simply doesn't cover legislation that has no shot of becoming law, and this week's hearing was no different. The Medicare for All bill, sponsored by Pramila Jayapal, currently has 121 co-sponsors, meaning that if it were put up for a vote today, it would lose by about 313 to 122. Or maybe they'd pick up a few of the non-co-sponsors, but either way, it would be a bloodbath. But still, a hearing can be a chance to make your case to the public if you can get the public's attention, and Katie Porter did just that with some creative questioning.
What percentage of revenue do private insurance companies spend on administrative costs?
Between about 17 to 18% of spending in private insurance plans.
So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. What about Medicare? What do they spend on administrative costs?
That range is about 3 to 5%.
3 to 5%. About 3 to 5%, right here. And if we look at just billing costs, just billing and insurance costs, Medicare is at 1%. Wait, private companies spend 17 times more on administrative costs than Medicare? What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does? Dr. Collins?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on health care every year. We could save $200 billion on administrative costs with Medicare for All. And those savings, they could go to expand Medicare. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. We're not talking about paying to keep the lights on in operating rooms or improving the quality of care. All of this money is used to pay big insurance to push paper. It's death by 200 billion paper cuts.
Now, all of that's true, yet while half the Democratic Party is still pushing for Medicare for all, Medicare itself is being rapidly privatized while nobody's looking. A report this month from the typically staid Medicare Payment Advisory Commission was flagged by longtime healthcare reporter Merrill Guzner in his excellent Substack Guz News. The program insurers are using to privatize Medicare is called Medicare Advantage. And through a variety of gimmicks, they lure seniors into plans, often by offering dental or eyeglass coverage, though how good that coverage is, seniors only find out later. Then they use a trick known as upcoding to bilk the federal government. It may have cost taxpayers up to $20 billion last year. The Payment Advisory Commission is sounding the alarm, warning, quote, a major overhaul of Medicare Advantage policies is urgently needed, unquote. Medicare Advantage now covers 46% of Medicare beneficiaries, meaning the program is almost half privatized, and it grew by 10% each of the last 3 years. The commission warned that if this trajectory continues, it will, quote, further worsen Medicare's fiscal sustainability. It also creates a massively well-funded lobby to keep the program privatized and prevents any further gains in public insurance. The report states bluntly that since their inception in 1985, quote, private plans in the aggregate have never reduced savings for Medicare, unquote. Now, none of this is new. I wrote an expose on several Medicare Advantage companies ripping seniors off back in 2009. And then when Democrats finally made some modest reforms to it through Obamacare because it saved the government money, Republicans accused them of slashing Medicare. That's a pretty neat rhetorical trick there. If you'll recall, that was a huge theme of the Tea Party back in 2010, keep your government hands off my Medicare. and so private hands are looting it instead. And so how does a libertarian think about the Medicare versus private insurance contradictions?
I have a hard time believing that the government-run program has fewer administrative costs than the privately run program, but presumably those details weren't being made up but I'm sure it's a confusing issue and it's hard to know for sure, but
it makes sense if you think about the incentives, because the private insurance company's incentive is to spend as little money on care as possible. So like if you say that you need, a knee replacement, the private insurance company's job is to be like, are you sure? How's that knee really feel? Maybe wait like 6 months.
Well, but the government-run system has no incentive either way. It has no incentive to check any. Doesn't matter how much is being spent. That no one is going to be like, oh, can we really? How do we prioritize?
That's the flip side risk, and those don't get classified under administrative costs, because they'll say, okay, you met these qualifications. Boom, you need a knee replacement, you get a knee replacement.
Right.
Here's how much we pay. And Medicare is also good at, because they have all of this buying power, even though they're banned from using it on drugs.
Right.
But they can.
Well, I agree with you on that. They should be able to.
But they can use it with orthopedics. And so they say, look, we pay, I don't know, whatever they pay, $12,000 for a knee replacement. Take it or leave it. And so the doctors then are like, okay, fine. I'd rather charge a private insurance company $20,000, but all I can get from Medicare is this, so I'll do it for this. And that's why, a decent number of doctors now won't take Medicare, and they're moving to these concierge, just private models. But you're right, so you may end up spending more sometimes because you're being more generous with care. But the private insurance, that's why the administrative costs.
Do you have a problem with the concierge models? I feel like people who are willing to pay for better health insurance programs should be able to, if they have the resources to pay for them.
Right. My problem is the people who are uninsured and don't have access. That's where I reserve my anger for. To have a world where some people have these concierge doctors just at their beck and call, while other people can't even get basic care, is infuriating. But I put more of my energy on the side of the people who can't get basic care.
I worry that does the government always know what's better? Even with Obamacare, you would hear, I reported some stories of people who lost their coverage because their plan was was not considered good enough by Obamacare, even though they were perfectly happy with it and they thought it worked for them. And does the federal government really know what is the right choice for each and every individual family? That's what
Right, and so Obamacare, speaking of which, we have this element here, in the American Rescue Plan, they took, Obamacare had sucked for tons of people because premiums were high, deductibles were high. The American Rescue Plan basically filled in a lot of those gaps. Like if you're in a marketplace plan, you're getting almost completely subsidized. That expires basically in October. Around that time, it actually technically expires in November, but in October is when people are going to get their notices of what
Trump's going to be Speaker of the House,
what their rate increases are going to be, and what their out-of-pocket cost is going to be. And it's going to go from all close to zero, which has been a pretty good year from that perspective, to all of a sudden back to $10,000, $12,000 a year, or something obscene that people can't afford. Genius is over at the Democratic Party, timing that for October.
Brilliant. Best friend of electing more Republicans. No, it's interesting radar. I don't know. I don't know exactly how I feel about all these things. My limited involvement in the healthcare sector has me most worried about the disguising of prices and how people have no idea what they're paying for, and because of the nature of insurance, and even the private system has all these kinds of government.
Right.
It's just such a mess.
They're like
I don't
know. They're like a government, and that would be my answer to your question. That nobody's perfect at doing this, but a for-profit insurance company is going to put people through even more of a runaround trying to get care than a government-run plan is.
Yeah. Well, very interesting. Our rising panel will join us coming up next.